guys, welcome back to my YouTube channel. Hope you guys are well. This is me, Amna. I am registered pharmacist. Today we are going to talk about DHA, HAAD, SLE, MOH exam past paper. This is our first lesson on this subject. We are not just cover MCQs but also discuss the reason behind the correct answer. These are the most important MCQs for Arab countries exam for pharmacy license. So we are not going to waste our time, precious time. Let's move on the question paper. Question 1 is drug stored in the body. Fat. A. Fat. Body mostly consists on fat. B. Protein. Hormones. Enzyme made of protein. C. Connective tissue means bones. So D. Muscle. Not stored in the muscles. So correct answer is A plus B. The drug is stored in the fat and protein. Question 2 is if a drug has the same active ingredient acetaminophen like other drugs but not contain the same inactive excipient, collidol, silicon dioxide, magnesium oxide, many more like these excipient ingredient, these mean bioequivalence, same work inside the body, similar blood concentration and same effect. B is pharmaceutical equivalence, similar dosage form made perhaps by different manufacturer. C is pharmaceutical alternative, different dosage form. So answer D is A and B. So the correct answer is pharmaceutical equivalent because the similar dosage perhaps the different manufacturer, so kind of different excipient. Enkephalins are peptides. That enkephalins is a pentapeptide involved in regulating nociceptor, pain receptor in the body, have reduced the pain sensation of pain, nociception, and increase relief from pain like analgesic effects. So the correct answer is you can do it by yourself. Have necrotic antagonists. Necrotic are psychotic like drugs, exert action on assembling dose of opiates like act on the pain receptor. And 3 is are found only in the central nervous system, adrenal medulla and other peripheral tissue. Obviously they are found there. D cause blood vessels wall relaxation. Enkephalins contract the blood vessels. E is transmit pain impulse, so they are relieving. So the correct answer is opiates. Question number 4 is to know the severity of immunodeficiency in HIV. You can access the immunodeficiency in HIV by ESR, leukocyte, WBC's count, and CD4. But the more relevant method is CD4 count. It is maybe less than or equal to 200. So the correct answer is CD4 count. Question 5. The ethical principle of veracity. Veracity means facts required that A. We respect the right of other to make choice. B. We act honestly without deception. C. We avoid, remove or prevent harm. D. We do good to patient. E. We act with fairness. The correct answer is B. We act with honesty without deception because veracity means facts. Question number 6. The style of management in which the owner of pharmacy emphasize the development of detailed policies written procedure for employees to observe all detail is referred to as A. Autocratic. Autocratic is a type of management style where one person controls all the decision and take very little input from the other group member. B. Bureaucratic, a system of management where official duties are fixed. Employees in this form of leadership are expected to follow specific rules, authority created by their supervisor. C is participative leadership style whereby the leader listen to their employees and involve them in the decision making process. D is benevolent, those who create the visible benefit, action or outcome for the common good. Consultative, a leadership style that target farm building and the use skills of the other to create plans or make decisions. The correct answer is B. Bureaucratic. Is a patient purchasing sublingual nitroglycerin tablets should be stored in the medication. A. In the refrigerator. B. Plastic vial with the child-proof cap. C. With the original cotton. D. Is the amber glass bottle with a metal cap. D. E. Is in warm, dry place. Nitroglycerin is volatile substance, so we must store in the amber glass bottle in metal cap. The correct answer is D. Following the ethical principle of no maleficence required that pharmacist. Maleficence is evil act. Now, A. Respect the right of patient to make choices. B. To do good to patient, placing the benefit of the patient above all else. C. Avoid, remove or prevent harm from people. D. Act the fairness, allowing people access to pharmacy care. E. Act with honestly without deception. The correct answer is C. Avoid or remove or prevent harm from people. Question number 9 is numerical based. Preparation containing coal tar 30 part petrolatum, 15 part adequate to 150 part watt concentration of petrolatum, in total 500 ml. To look, 15 part of petrolatum in 150 part. To total 150 part contain 15 part of petrolatum. It's mean the X part contain 15 parts and 150 parts are in 500 ml. So you can calculate the X part ml. It's 50 ml of part, 50 ml part of the total volume contained petrolatum. So this is the correct answer. Is hydroxyurea is used to treat sickle cell disease, polycythemia vera, myeloproliferative neoplasm yani bone marrow cancer. So question D is all of the above. So hydroxyurea is a cancer drug that slows down the growth of new cell in the body. So in all of above three disease, we can use hydroxyurea because it can slow down the growth of the cell. So the correct answer is D. Thank you. Please do comments if you have any query regarding this question and answer, and please do like and subscribe to get notification for the second lecture. Thank you.